Welcome to our presentation. Our presentation about statistical analysis of the COVID-19 pandemic.
In our report, we aim to analyze the worldwide effects of the COVID-19 epidemic from various perspectives. These analysis is based on analysis of factors such as COVID-19 cases and death rates in different countries. And to analyze this topic, we started with data collection, and we collected these data from various sources, such as the World Health Organization, Johns Hopkins University, and the other national health ministries. We made sure that the data we are getting is safe. Zeren?
Below are the 10 countries most affected by the pandemic and the total number of cases worldwide. The graph helped us compare the total number of cases of the countries and identify the regions where the epidemic is most intense.
In this topic, the pie chart below is a visualization of death rates by gender. With this output, we were able to make predictions about whether gender had an impact on mortality rates due to COVID-19, as you can see.
And when we keep going, we analyze another data set. And this data set shows the death rates by pre-existing health conditions. And with this analysis, it helps us to determine which health conditions increase the risk of death associated with COVID-19. And you can see the results in the screen too.
The graphic below illustrates the number of COVID-19 instances in Italy throughout the period of full lockdown. This output displays the number of cases and trends over time for Italy's 56-day full lockdown, one of the countries hardest hit by pandemic. This charts of cases from March 9 to 2020 to May 4, 2020 helped us comprehend the effects of the entire lockdown.
And as can be seen in the graph, the 56-day full closure did not make a noticeable difference. However, as it can be seen, the number of cases increased even more.
According to normal test results, we tried to interpret whether the data confirmed the normal distribution. And normal tests were important in determining whether the data were suitable for statistic analysis. We preferred the Shapiro-Wilk test to ensure that the data followed a normal distribution. Looking at the results we obtained, we conclude that these variables didn't have a normal distribution because we saw the p-values of each variables were very small.
And when we keep going with the point estimations and confidence intervals, they were important to us as they showed whether the average number of cases within a certain confidence interval. We believe that by calculating the mean value of the data and assigning the 95% confidence interval, we have obtained a reliable estimate of the average number of cases.
With hypothesis testing, we test whether the average number of cases differs from a certain value. This test helps us determine whether COVID-19 case numbers showed statistically significant differences. For example, we test whether the average number of cases differed from 100,000.
In this topic, we used the chi-squared fit test to evaluate whether the data fit a particle distribution. This test showed how well the data fit the distribution and helped us understand how well the model fit the data.
And when we keep going, we examine the relationship between dependent and independent variables by creating a linear regression model. This analysis helped us see the relationship between COVID-19 case numbers and deaths.
We used ANOVA test to examine differences between groups. With this analysis, we understood the differences in the number of cases between countries. For example, we have seen whether there are statistically significant differences between the number of COVID-19 cases in different countries.
In this topic, we analyze data using non-parametric tests. Of these, we prefer the Wilcoxon test. When we saw a p-value of 0.086, we thought there was no significant difference. That is, the total number of deaths between the low case number and high case number groups shows that we should look for a statistically significant difference.
And before we come to the conclusions and recommendations, I would like to say that we use two additional statistical methods too, which is correlation analysis and cluster analysis. We are not going to talk about them because of the time limit, but in our report, we explained in a detailed way. You can read these methods, codes, and outputs from our report. And when we come to the conclusions, we can see that with these analyses, we concluded that there are significant differences in the number of cases between countries. The USA, India, and Brazil, known for their large populations, stood out at the top of the lists as regions bearing the highest burden of the epidemic. But since there is a linear increase between the number of cases and popular density, it did not surprise us that these countries were at the top of the list. And another conclusion, when we looked at the death rates by gender, we saw that men had higher death rates than women. And actually, we don't know the reason for this finding. The other conclusion, when we looked at the data, we found that people with pre-existing life-threatening health conditions, such as cardiovascular disease, diabetes, and chronic respiratory illnesses, they had significantly higher death rates. With this result, we understood the importance of protecting these groups during pandemics and prioritizing them in elective treatments such as vaccines. When we come to the implications and recommendations, Neşe, what are your suggestions about these analysis conclusions?
In implications and recommendations based on the results we obtained from the analysis, we made many important inferences for public health policy and pandemic preparedness. Target interventions after seeing the high death rates in men and the high death rates of individuals with pre-existing conditions. Global cooperation, significant differences in the number of cases between countries, effective fight against the pandemic, and sustainability of not only human life, but also global communication, trade, and orderly economy. It shows us the importance of global cooperation and information sharing in order to prevent global crisis. In conclusion, this report has guided us through statistical analysis in understanding the dynamics of the COVID-19 epidemic. By applying a variety of statistical methods, we gained a more detailed understanding of the factors affecting the transmissions rate and impact of the virus, and were able to make inferences for effective public health strategies and interventions.
That was our project. Thank you for listening.